Welcome to another episode of Talk Teach Nurse. I'm going over nursing fundamentals today, and we're going to look at pressure ulcers. So here I have my models. I want to show a different representation of someone that is fair skinned as compared to a person of color. Remember, as we assess these patients, certain things look different based off the person's complexion of their skin. So as you can see here, we'll be able to compare, say, a stage 1 pressure ulcer on a person with fair skin compared to a person on dark complexion, as well as the stage 2. I want you to notice the differences in them and how they present. So stage 1, we know stage 1, that is an ischemic pressure ulcer. We're able to tell by looking at it, evaluation, and seeing whether or not it blanches. Now we look at stage 2. Once we look at stage 2, this is a little bit further on. With that stage 2 ischemic pressure ulcer, we're going to make sure that we are palpating around it, see if the skin is blanchable, but also make sure you're taking measurements of it. One of the things you want to do with pressure ulcers is make sure that you are keeping record of things that you are doing to make it work to kind of help heal it, and make sure you keep the shape and the size of it so you know what's working and what's not working. So this is a unstageable pressure ulcer, pressure injury with slough and eschar. The reason it's unstageable because it is not any depth to it right now. So the one under it there's actually going to be a stage 3 pressure ulcer because we can see the subcutaneous fat, the slough that's on there, granulation tissue undermining, as well as the tunneling. Now when we get here on the back, we're going to notice that stage 4 pressure injury with eschar, subcutaneous fat undermining, the tunneling, the slough, as well as the exposed bone. That exposed bone is going to be an indication of osteomyelitis, as well as the rolled edges that are down there. So all of these here on the person that's fair skin, we're going to be able to see as well. That's stage 1 and the way that it presents, comparing it to the stage 2 and how that stage 2 ischemic pressure ulcer is presenting to it, as well as turning to the side and seeing our unstageable there at the top. It's unstageable, however, we do see the slough and the eschar there, but we also see the stage 3 that I'm pointing at now, with the subcutaneous fat, the slough, granulation tissue undermining, and the tunneling. The tunneling is deep there on the side. So stage 3, you don't see the presence of the bone just yet, but you are also able to see the difference in unstageable and stageable. Now to graduate to that stage 4, now we're going to see that eschar. Now we're seeing subcutaneous fat undermining, the tumbling, and the slough, but now we have that exposed bone with osteomyelitis listed there. So the main things that we're doing here with patient education is making sure that we are assessing it, that we are reevaluating, and we're trying to address it. Also, remember that pressure ulcers are not only for the pressure back area. It can also be placed on your foot. Like this patient could be a diabetic patient that's lack of circulation, or a person who's not able to move and they don't have a pillow under their heels. So thank you for listening. Thank you for watching. Make sure you like, subscribe, and comment below.